Welcome to The Opposing View, the podcast where ideas collide and assumptions get challenged. I'm your host, and today we're tackling a silent but escalating threat: antibiotic resistance. The format is simple: two experts, two opposing views, one topic that affects us all. Is antibiotic resistance the ticking time bomb of modern medicine, or are we overestimating the threat compared to other global health challenges? Let's meet our guests. Introducing the experts. On the pro side, we have Dr. Marcus Hofstad, infectious disease specialist and advisor to an antimicrobial resistance task force. He argues that antibiotic resistance is the most urgent and underestimated global health emergency today. On the contra side, we're joined by Dr. Yuval Devani, epidemiologist and global health strategist, who believes we've exaggerated the risk and misallocated resources that could better address other, more immediate health crises. Dr. Hofstad, you may open the debate.
Thank you, John. Antibiotic resistance isn't just coming, it's here. We're already seeing patients die from once curable infections. According to the latest Lancet report, nearly 5 million deaths were associated with drug-resistant infections in 2019 alone. If we lose antibiotics, we lose modern medicine. Surgeries, chemotherapy, even childbirth becomes high risk. Resistant bacteria don't care about borders. Without urgent action, we're looking at a post-antibiotic era, where even a scratch could become fatal.
Powerful opening there from Dr. Hofstad, laying out a grim future if resistance continues unchecked. But is it really the most imminent threat? Or are we losing perspective? Let's hear now from Dr. Yuval Devani.
While antibiotic resistance is serious, it's not the doomsday scenario some portray. The data is often inflated by modeling worst-case projections. Meanwhile, more people die from preventable diseases like diabetes or lack of clean water. Investments in antibiotic R&D have increased, and newer diagnostic tools help reduce misuse. Also, resistance has existed since antibiotics were first discovered. It's not new, and it's manageable with proper stewardship. We should be proportionate in our concern.
Two compelling arguments, but let's take it a level deeper. Now it's time for rebuttals, where each expert gets a chance to challenge the other's view.
Dr. Devani raises valid concerns about prioritization, but this isn't theoretical. We're already facing pan-resistant infections. In neonatal wards in parts of India and sub-Saharan Africa, no effective antibiotics remain. That's not future risk, it's present reality. Take the case of Klebsiella pneumonia, a common bacterium that has evolved into pan-resistant strains. In a 2017 study published in the Lancet Infectious Diseases, researchers reported that up to 70% of newborns with sepsis in Indian hospitals died when infected with these strains because no antibiotics worked. This isn't just tragic, it's a preview. Comparing antimicrobial resistance, AMR, to lifestyle diseases like diabetes misses a critical point. Resistance spreads, lifestyle diseases don't. Resistance genes don't respect borders. They jump between bacteria, between people, even across species. And this happens exponentially, not linearly. If we wait until resistance becomes unmanageable globally, it'll be too late to stop it. This is not about alarmism. It's about the basic math of microbial evolution.
So, Dr. Hofstad says the risk isn't overblown. It's underacknowledged. But how does Dr. Devani respond to that sense of urgency?
It's a problem, yes, but one among many. Urgency shouldn't justify panic. In fact, antimicrobial stewardship programs are working in many regions. Resistance levels are stable or even declining in countries with proper oversight. We must also consider opportunity cost. For every dollar spent sounding alarm bells here, we're taking away from climate adaptation, mental health crises, or pandemic preparedness, all of which also have global implications. It's a problem, yes, but one among many. And we have to be careful not to let urgency tip into alarmism. Antimicrobial resistance, AMR, is real, but it is not uniformly catastrophic. And the narrative that we're entering a post-antibiotic era tomorrow simply doesn't reflect the full scientific landscape. In fact, antimicrobial stewardship programs are working, and not just in a few isolated countries. A 2023 OECD report found that with targeted interventions, up to 75% of AMR-related deaths in high-income countries can be avoided. Countries like the UK, Japan, and Australia have implemented stewardship, surveillance, and infection control programs that have stabilized or even reduced resistance rates for key pathogens. Take methicillin-resistant Staphylococcus aureus, MRSA, as an example. In the United States, MRSA infections in hospitals have declined by over 50% since 2005, thanks to better hygiene, diagnostics, and prescribing practices. That's not just theoretical success, it's proof that policy works.
Now, are there regions where AMR is more severe? Absolutely. But instead of sounding global alarm bells that divert resources, we should be focusing on capacity building in health systems that lack oversight, not assuming a global collapse.
And the narrative that AMR amplifies other risks may sound compelling rhetorically, but it can also obscure the distinction between compounding and competing priorities. We can't solve every problem by treating it as the problem. That's not prioritization. It's panic. We need to think systemically, proportionally, and globally. That means acknowledging AMR is serious, yes, but not unique in its urgency or scale. It deserves strategic investment, not a disproportionate share of limited resources based on worst-case extrapolations.
Two opposing views, both rooted in data, both raising critical questions. Is antibiotic resistance the defining health crisis of our time? Or just one piece in a much larger puzzle of global health risks? You decide. Until next time, stay critical, stay curious,